In today's episode of Pinoy Nurse Portal, we will talk about one of the most important terms you need to understand as a future USRN. We will talk about HIPAA. What does it stand for and what are your nursing responsibilities? Ignorance of this law can get you in trouble. You can get fined, you can get sued, you can get suspended or even fired. I personally know someone who violated this law and got fired. Okay, so hello, this is your nurse Rebecca for Pinoy Nurse Portal. So without further ado, let's go get right into it. In the medical field, ignorance of law is not a bliss. Ignorance of law is ignorance, period. Okay, so like I said, we will talk about HIPAA and why is it important in practicing as a USRN. HIPAA stands for Health Insurance Portability and Accountability Act of 1996. It is a federal law that required the creation of national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. So what does it mean to you as a nurse? Before we continue, let me give you a scenario, okay? All right, so scenario number one, I will give you different types of scenarios. That way you can really grasp the nursing responsibilities in regards to this law, okay? So let's start with admission. This is the first scenario. You are caring for a 34-year-old male patient who was admitted for facial fracture and was accompanied by 2 police officers. When you exited the patient's room, the relative of another patient asked you, what's wrong with the patient? Why was he accompanied by police officers? Your correct response should be letter A. I don't know yet. He just got here. But if you wait, I'll let you know in a few minutes. And I want you to write your answer in the comment down below. That's the first choice. And letter B. Oh, he punched a cashier at Walmart. And letter C. I'm sorry, I'm not allowed to give you that information. So based on the definition of HIPAA, what is the correct answer? If you answered letter A, you are wrong. If you answered letter B, you are still wrong. The correct answer should be, I'm sorry, I cannot give you that information. As a future USRN, I'd like you to develop good habits, okay? Develop the habit of saying no. It could be your friend asking about the patient and she could be from a different floor. It's okay to say no or tell her para hindi siya ma-offend. So you are not offending her. Let me tell you a scenario. When I first came here in the United States, me and my friend Jennifer came together and she used to tell me no, but she doesn't say no directly. If I ask her, hey, what's wrong with your patient? She will tell me, Hipaa. That's her way of telling me that she doesn't want to share information about her patient. And she was doing the right thing and I wasn't, okay? Well, anyway, to continue, let me give you more scenario and how it's done in the United States from admission to discharging a patient, okay? Let's say, for example, the patient went to the emergency room. What happens is they will ask them information. This is through the registration, okay? So while the nurse is caring for the patient, the registration will be called and they will ask the patient some information. And then the registration's responsibility is to print a label. All patients will be given a set of labels that look like this and will be given a bracelet. The bracelet will have the patient's name, patient's birthday, and the medical record number, okay? So nursing responsibility. If the patient's bracelet will fall off or for whatever reason it gets damaged and you need to replace it, you as a nurse will not throw it away in a regular trash bin, okay? It has to go to a shredder. If your nurse station will not have a shredder, usually they will have a big black box that looks like this and it will have a lock. That's where you will throw away all patients' information that needs to be shred or needs to be thrown away, okay? Back in the days when we were still using paper charting, we put these labels in the patient's chart, all the patient's chart back to back. Now that we are charting electronically, we still use patient's label. We use this to label the patient's belonging bags. We use this to label the patient's food. We use this to label, for example, they come in and they have crutches, wheelchair, or walker. We use that to label their belongings, okay? So nursing responsibility, if the patient gets discharged and you have a lot of labels left, what do? You don't throw it in a regular trash bin. You put it in the shredder box or you shred the patient's information. Okay? All right, let's proceed by giving you another scenario. Your patient who was complaining of abdominal pain went for ultrasound today. After the test, your patient asked to get a copy of the request. So what's your correct response should be? Letter A, our printer is not working, but I can ask another floor to print it for you. Letter B, yes, of course, I'd be happy to help you with that. Or letter C, I can have the doctor discuss the result to you, but if you want a copy of the result, you need to request it from medical records. So what's the correct answer? If you answered A or B, those are wrong. But if you answered letter C, that's the correct answer. In our hospital, now again, check the protocol or policy in your hospital. But in our hospital right now, if the patient wants a copy of their medical record, you as a nurse are not allowed to print it, okay, and give it to them. They have to go to the medical records to ask, especially for the results. Scenario number 3, and this is the case of someone that I know. We will not mention any names. We will tweak the name of the floor and we will tweak everything, but the scenario is similar, kind of similar to what happened to the person I know. Okay, so scenario number 3, you are a nurse working at the med-surg floor. Your daughter was admitted at the OBGYN floor. Your daughter told you that her nurse is too busy to talk to her about her ultrasound result. She asked you a favor to open her chart and look at the ultrasound result. You as the mother or the parent of that patient, are you allowed to do that? Letter A, yes. Letter B, no. I think you already know the answer. The answer, of course, is no. Okay? So in this situation, what happened was, and this is a true story, the employee working in a different floor opened the chart of the relative admitted in a different floor. What happened was there was some anomaly or something questionable in one of the results of the patient. What the parent did, who's working in a different floor, went to her daughter's floor or to the relative's floor and confronted the nurse. And that's how they knew he opened the chart, and that's how this person was fired. Okay, so remember, you are violating the law in doing that. Do not ever open a chart of a patient that is not assigned to you. There are some exemptions. For example, I am the charge nurse and one of my nurses comes to me and asks me for help. Sometimes I really need to open the patient's chart to be able to look at the scenario and to look at some results to be able to help my nurses in that case. Or for example, you are not the charge nurse and another nurse wants some help from you in regards to taking care of her patient. Can you open the patient's chart? Yes, because sometimes you need to see the chart to be able to help other nurse, okay? And I am talking about you are working in the same floor, okay? Another exemption, for example, I worked 3 nights in a row and the following week when I came back, my charge nurse told me, hey Rebecca, you did not chart this. Can you please go back to the patient chart and do this? You can open the patient's chart again even if that patient is not assigned to you on that week anymore, okay? You can go back to the patient's chart whom you cared the week before to correct the charting you missed, okay? Those are some of the exemption in opening other patients' chart even if they are not assigned to you. Next, discharging a patient. Your question might be, am I allowed to give them health education while there are relatives in the room? The answer is yes if the patient will allow you to, okay? Next, in regards to Hipaa violation or the Hipaa law, when discharging a patient and you have a lot of unused IV fluids or IV drips that looks like this, housekeeping will not discard this for you. It is your nursing responsibility to strip everything off that has a patient's label, especially your IVs, okay? And for example, your IV is halfway done. What you need to do is drain it in the sink. When I first came here, my preceptor said, just drain it in the sink. Ano kayang ibig sabihin niya? What did she mean by that? So I was like a little confused, but she showed me the proper way to do it. If your unused IV is just regular IV, let's say normal saline or LR, and it has potassium and magnesium, it's okay to drain it in the sink, okay? The rest of your drips that has medication, it has to be discarded in a special container, and it's usually a black bin that sits in your medication room. Now again, check the policy and protocol of your hospital, okay? So now with regards to Hipaa, remove all the patient's label that are left in the patient's room when discharging the patient, because like I said, housekeeping will not touch any of those, okay? So what else can I share in regards to Hipaa law? When you come over here, make sure to develop good habits. One of them is, since we are now charting electronically, let's say, for example, you are in the hallway and the patient's chart is open, because our chart looks like this. You can push this anywhere. You can put it in the patient's room, you can put it in the hallways, or you could put it anywhere in your floor, okay? So let's say, for example, your chart is open and you are in the hallway and you are about to step out away from the computer because you need something. Develop good habits by logging out or minimizing your screen, okay? Again, check the policies and protocol of your hospital. Number 2, anything that has the patient's name or medical record, anything that has the patient's information, including the medications that looks like this, all medications that comes from pharmacy that we cannot pull out of the Pyxis. The Pyxis looks like this. It will have the pharmacy label that has the patient's medical record number and their name, okay? Please do not throw it away in the garbage bin, okay? Or if you need to remove the label of the patient, or if you cannot remove the label, you can also erase the name of the patient by using a marker or the pen. Isulat nyo lang, just blacken the name of the patient from the patient label and you could throw it away in a regular bin, okay? Next, using cell phone at work. Again, check your policies and protocol in your hospital. In our hospital right now, it's okay for us to use our phone provided that we are not taking patient's picture and we are using our phone during our break, okay? I have friends in the Philippines that are nurses and I see them posting pictures at their nurse station with their patients in the picture. In the United States, that's a big no. You are not allowed to use your phone to take pictures of your patients. Please don't do that. That's a really big Hipaa violation. So what if the patient will ask you to take a picture of them, or take a picture, for example, they want to take a picture of their wounds? Again, my answer will be check the policies and protocol of your hospital. In our hospital right now, since I work at the burn unit, our patients are not allowed to take a picture of their wound from their cell phone, okay? Not unless you're not looking. But if I were at bedside and they're about to take a picture of their wounds, I will tell them not to do it. They can argue with me, they can hate me for telling them, but at least you did your job as a nurse to tell them, to make them understand the policy and the protocol of your hospital. Okay, another thing, for example, you as a nurse and the CNA are talking about the case of the patient. Are you allowed to do that? Both of you, the nurse and the CNA, are involved in the care of the patient. Are you allowed to talk about the patient? It is inevitable for nurses and CNAs to talk about our patient, or sometimes we complain about them, but please do it discreetly. Make sure that the relatives are not listening, that other patients are not listening. You could discuss this, okay? Since you are both caring for the patient, discuss this somewhere private, discuss this at the nurse station or in your break room. And there you have it, guys. Thank you so much for watching today's episode of Pinoy Nurse Portal. Once again, this is your nurse, Rebecca, saying thank you so much. And please, if you're not a subscriber yet, please don't forget to subscribe. And please comment down below if you learned something or if you have more questions. And please don't forget to follow me on my other social media accounts. It should be here in the screen. And please watch these videos over here. Remember, future RNs, okay, before opening your mouth or before discussing anything to others, ask the question, am I violating the patient's privacy? Thank you so much for watching. See you on our next vlog.